Hello, everyone. Welcome or welcome back to another session of A Day with your fertility specialist. It's so lovely having you here. We really do love every time that you click on our live sessions, you like a video, you share it to your friends, your family, someone that you think would be interested in a topic that we're talking about. Today, we're going to be talking about age and fertility. I know you've heard this topic on here a lot, but have you heard about what medicine can change or cannot change about how age affects fertility? Well, today we have Dr. Ken Eguda with us. Hello, sir. Welcome. In case you do not know, you're joining us for the first time. Dr. Ken is a consultant gynecologist. He's also a fertility specialist, an IVF specialist. He is also a minimal access surgeon. So, yes, we have a lot of qualifications going on here. And like I always say, our guests have a lot to tell us about things that we're unsure of. So, if you think someone will be interested in this topic or you yourself are interested in it, well, stick around to find out more and share this with someone you know would learn a little more from this topic. So, Dr. Ken, what medicine can or cannot change about age and fertility? I know we have a lot of notions about age and fertility, especially with women. People say, oh, by this age, you're barren, or you can never give birth again, or you can never do this, you can never do that. And then there's also men thinking, oh, they're completely fertile for life, nothing affects their fertility. So what do you have to say about these notions and what exactly is true in the medical sense?
Oh wow, great. I like the topic age and fertility, what medicine can and cannot
Not change, yeah.
change. Yes. Oh, well, at the moment, medicine cannot change aging. Aging will just have to happen. Although we're getting to a point where aging can be debatable, or can be altered or changed
Yeah.
or affected. But at the moment, what we have within the public domain or the realms of men is that aging just keeps happening, and I would like to start from the men.
Yeah.
Growing up as young doctors, we felt that men do not age with respect to reproduction, that a man can
Mm,
just make a woman pregnant anytime he
exactly.
chooses, but that's wrong. you know um, Men can have problems with fertility. I mean, right from childhood.
Wow.
You
Okay.
understand? Yeah. Especially when they have problem with their testicles,
Mm,
abnormalities with the testicles or genetic abnormalities, and then they still keep grow, and then they find it difficult to produce sperms, or there are no sperms, and so pregnancy doesn't just happen.
yeah.
But then when men are aging, a whole lot of things happen, you know, and those things may just not be corrected with medicine,
Mm,
because as men are aging, the quality of their sperms depreciates. You know, the quality which covers morphology, motility, and some other stuff. Even the DNA in the sperms,
oh, wow.
they get lead to abnormal as men are
With age.
aging. Yes, and the chances of having abnormal kids, you know, it's high
Mm,
when men are aging. You know, we're talking of aging 40 and above,
okay.
for
Okay.
men,
Yeah.
you know. Yeah, and at that stage, age related diseases are
On
also
the rise.
common, like hypertension, diabetes, and some maybe collagen abnormalities,
Yeah.
and men are likely going to be on medications. Some of the medications have negative effects
Oh,
on the
wow.
sperms, and particularly the antihypertensives,
Hmm.
you know. And even when you are hypertensive without medication, just being hypertensive
It's already.
affects the sperms and reduces your
Hmm.
chance of making a woman pregnant. Okay, so it just affects all of those things. You know, yeah. So fertility just declines generally as men
Yeah.
go old, and chance of having babies with syndromes.
It's high.
Yeah, these days we see that the rate of having autistic kids
Hmm.
is a lot higher.
Mm-hmm.
you know, and a good number of this because of age related conditions affecting sperms of men,
Yeah.
you know. So yeah, it affects men so much. Some of these conditions can be altered with medications, but then the real aging itself and the quality of sperms may not be
Be able
changed
to
by
change.
medicine.
Yeah.
You just have to deal with whatever comes at that point in time. So that's how it affects men. And of course, for fertility reasons, now we observe that more miscarriages, for instance,
Okay.
happen because of abnormalities with
Wow.
than even with the female gametes. You know, so it's really getting bad.
Yeah.
When you go to the female folks now, usually we always talk about biological clock, chronological clocks
Yeah.
affecting just women, but of course we know now that it affects men.
Of course.
You know, everything about a woman's life is time and age
Yes.
dependent. You know, but it's interesting to see that a good number of women don't understand this. A woman thinks that because she menstruates every month, it means she ovulates every month. She could get pregnant when she wishes, not really knowing that, yeah, you could actually be menstruating, but you have no good eggs to
Yeah.
achieve pregnancy early as you're getting older. And no medicine can change that. So those are things that medicine
Cannot
cannot
change.
change. Medicine can't change. When you're getting older as a woman, the air quality depreciates. So chance of getting pregnant is a little lower. Chance of having miscarriages are higher,
Yeah.
and chance of not even getting pregnant
At
is
all.
there,
Yeah.
you know. So medicine doesn't just change that. And you see a lot of women come to the clinic for instance and say, "He just boost my eggs." They just want the egg boosted. See, there no medication
For
you
your
could give
phone
me
you
to just
charge
boost
or
my eggs.
something.
Ovarian reserve is already low and you want it boosted. Boosting from
From
where?
where exactly?
You could only give medication to help control the health around ovulation around the body, but not necessarily making the eggs better.
I mean, what's in the bank is already
Exactly. It's a
pretty much
reserve.
low. Yeah.
It's a reserve. And once the reserve is low, it's actually low. Yeah, except that for now, because there are interventions that you could activate dormant follicles.
Okay.
We call that ovarian rejuvenation, ovarian activation, and that can help to activate dormant follicle, and then you could just spring up with some ovulation even at some advanced age,
So is
and
that
and you could get pregnant with
that's something
that.
that we can see medicine can
Yeah,
change.
medicine can change
Yeah.
that. Okay, yeah, medicine can change that. So but aging is just negative
All in
when it
all.
gets to reproduction to a large extent. Yeah,
Okay.
and it's not getting better,
Yeah, I don't think
just
so.
not getting
Yeah.
better.
Well, are there any other things you could say medicine would change in relation to fertility itself? I know we've established how medicine can't really change your age. You can't reverse, but
Yeah.
what other interventions can we expect or can we think of when when you have a client that comes in and is already of advanced age?
When clients of advanced age, it's usually okay to have a very good discussion with them. Yeah, because they need to know that their chances of getting pregnant with their eggs are low. And for some, they just have no eggs. For instance, if they are females,
Yeah.
and then they may just be good to go with gametes or eggs or oocyte donation. You know, so those are alternatives to your own eggs when it is obvious that you are out of
Yeah.
reserve, out of egg bank.
Yeah.
So egg donation, which is very rampant, and it's very difficult actually to accept egg donation from what we see from the clinics. Yeah, it's difficult to just throw the option of egg donation to a woman and she smiles at it
Yeah.
and accept. If she accepts it at the first instance, she probably
Probably
had
already
battled
know.
with it long ago
Yeah,
before coming to
exactly.
meet you. So she had dealt with the fights, and overcome the inertia, or the apathy for egg donation. And then she has come to terms with the reality before accepting it. So a good number of women actually would just do well with egg donation because the chance of getting pregnant using egg donation is a lot higher than trying with your eggs when you are like 42, 44, or
Okay.
46. For instance, chances of getting pregnant with your egg at 46 is about 1%.
Wow.
With assisted reproduction technology, it's about 1%.
Mm.
So you look at it, how often can you raise such amount of money
Exactly.
to strike at assisted reproduction technology? I mean, with the chances that is so, so egg donation is a very viable option. Then ovarian activation or rejuvenation, it's also an option for those who will not for any reason accept egg
Yes.
donation.
Okay.
you know for me, I see that a lot of women are getting into this stage, because the age of first marriage, as we see currently in the world, it's about of first pregnancy or first delivery. The average age of first delivery in the world currently is about 32 to 34.
Oh wow.
Yes, 32 to 34.
It's already.
Yeah, most women get their babies, first child, first kids at 32, 34, and which is not the case some 40, 20 years back. And
Yes.
that's because of sexual revolution, economic empowerment, social revolution, women education, and all of that. So it's having a negative toll on fertility. In Japan, for instance, about 34,
Wow.
and there's even no population. In
Exactly.
most European countries, 32, 34. Yeah, in Nigeria, it may be a little lower, but then the the female folk, it's getting
We
enlightened,
are.
getting advanced, economic empowered, social empowerment,
Yeah, and
and so it's also getting higher, and so we're going to have to deal with a lot of infertility, because if the age of pregnancy, for instance, is 34, official first pregnancy, I'm not talking of the miscarriages or
yeah.
the termination of pregnancies that happen when women are not ready, for one reason or the other. So you have your first kid at 34. At 35, the egg reserve deteriorates rapidly.
Yeah.
And so once you get to 35, for instance, for some women, it's unpredictable how soon you can get pregnant.
Exactly.
And at 37, for instance, over 70% of the reserve you have are already poor, bad eggs, and only 30%, according to research, may
Wow.
be in good condition.
That's a
So it
lot.
means that per time, a woman is likely to produce a poor egg from the age of 37.
That's quite
Yes, if you look at the
a
ratio,
short
7
time.
to
To
3,
three, exactly.
so if she's ovulating, it's likely
To
that
have
the poor,
more from the seven.
exactly, more from the 7, which is
Yeah.
poor.
Yeah.
And so chances of getting pregnant, all the miscarriages you see happen, they don't just happen. There's a reason why
Okay.
miscarriages happen: when egg is poor, or sperms are poor, or when the lining of the womb is poor, or
Okay.
when a woman has
Hmm.
or some metabolic condition or
Sure.
autoimmune conditions. Okay. So it's just usually these are the reasons why miscarriages happen. But it's usually the poor eggs that cause
Yeah.
them,
Yeah.
you know. And so since women just keep getting advanced, it's good for us to start thinking of how we make them secure or preserve fertility.
Exactly. Preserve.
Yeah,
Yes.
I
Yeah.
was in, I was seeing a woman. I was seeing a woman some months ago in some part of Nigeria, and then getting towards 40, and then and she had visited a clinic, fertility, and she was told that she was crying,
Of course.
and she didn't know what to do. But you know, she put the blame on. She put on the doctors or gynecologists who had her 10 years ago
Whoa.
of fibroids, tell her that she should look into fertility
Wow.
because she felt she's a lay person. She doesn't doesn't know that much, but she was seated before an expert who knows more than, and knew she was not my 30 going to have fibroid surgery, and it didn't care to tell her.
About that.
And she has to blame.
No, I mean, of course,
So
that's to
now we begin to
find.
tell them,
Yeah,
ladies should learn to freeze the eggs.
exactly.
Should learn to freeze because to getting older, you're left with poor eggs.
Mm-hmm.
The ones you're wasting, your oven, and the ones that are dying of following natural programming are better
Yeah,
than the ones you have at every point in time. So
I was going
can
to
be
ask
done so
about
that
that.
you on your fertility. And instead of battling with psychology, um, mentality of accepting egg donation, you
Donation,
have
yeah.
your eggs
You
that you can
already
fall
do.
on.
Hmm.
Yeah.
So, at what age would you recommend a client to actually freeze her egg? Like, if your
Huh?
client that probably isn't ready to, you know, get pregnant, they're thinking about having that in the future. What age range? I know you said from 35, ovarian reserve reduces rapidly. So, did I say anywhere below 35?
Anywhere below 35
Oh,
is
okay.
fine. Anywhere below the and if they come up 40, you could still do it because it's better done than not done at all.
Yeah.
But if you have the options, it's usually better 30s
Mm.
or late 20s. So a lady, I saw a lady, I mean, who has been married for like 2 years,
Mm-hmm.
and then she's not ready to have babies, and she paid consultation to see me to continue family planning. I mean, contraception.
Wow.
I told her that, well, you may be sitting with the wrong man.
I mean,
Oh, yeah, I say, okay, let's talk about contraception. I had to first of all look at what your reserve is like
exactly. Mm-hmm.
and see what your husband's reserve is also like.
Mm-hmm.
Because there's no doing contraception when we don't
When
know what your reserve
you're not
is.
you're not holding on to anything, and you're
Exactly.
just
Because if we want to do contraception, for instance, and we see you want to still hold on not getting pregnant for the next 3 to 4 years,
mm-hmm.
and we observe that
Decline.
have
Yeah.
level, I mean level, and there's no use doing contraception.
Yeah.
Do something or to preserve fertility.
That first.
You know,
Mm-hmm.
freeze the eggs.
Mm-hmm.
Do your contraception. That's the thing in this day and time.
Yeah.
So contraception is okay. I want to get. I've not been pregnant before. I want to. I don't want to get pregnant. We should have reason to do that.
Mm-hmm.
We should be sure that when you are ready to get pregnant, eggs to still strike at pregnancy. Okay, so women need to have a dynamic
Shift
shift
in
in their
mentality.
mindset.
Yeah. Exactly.
We had fertility preservation a lot and what to make them have good eggs. I know babies are actually of more quality when given birth by younger parents
True.
than
That's
older
true.
parents.
Yes. Because, I mean,
Understand? Because
like
the
you
gametes
mentioned.
are better. You
Yes.
may not have someone
No, it
says,
is. That's
you know,
true. That's true.
when you have eggs of older women with a lot of abnormalities and they manage to bring about baby, of course, you're likely going to have some.
Abnormalities. But we're talking about another fertility treatment or say method, them accepting oocyte donor egg. But can we discuss a little bit about IVF? I know this topic comes a lot, but I mean, if they're already at the stage of being advanced in age,
Mhm.
and we have the as an option, what other options would I say? Assisted reproductive options would they have? IVF, is that something that recommend?
Sure, if they have need for IVF, for
Mhm.
instance, yeah, the fact that it's in age doesn't mean they have to have an
IVF,
IVF.
yeah.
They only have IVF if occasions or reasons for IVF.
Mm-hmm.
If a woman is advanced in age, she automatically needs an IVF.
Mm-hmm.
If a woman is advanced in age and the husband's sperms are so low, automatically too may need an
Mm-hmm.
IVF. You know, So there are a lot of reasons. Has habitual miscarriages for no reason. She did an IVF so that you could do advanced IVF, check the genetics of the babies. I mean, IVF with pre-implantation genetic diagnosis, so
Exactly.
you know whether there are genetic abnormalities with the gametes coming about to make the baby,
Mm-hmm.
so you can advise them on which way to go or to select is healthy. I mean, embryos now, that's what I call babies.
Yeah.
To I mean, transfer into the uterine cavity.
Mm.
So yeah, options are endless. You IVF, egg donation, and all of that. It even reminds me, sometimes you see this in the 20s and you tell them they need IVF,
And the
and
leg.
we thought IVF is old
Old people,
people. It's
yeah.
not for old people.
Mm-hmm.
It's for anybody who meets the condition for
Of
IVF.
having
You
an
can be even years old and you have blocked fallopian tubes. So automatically,
Yeah.
45 and you just get married.
I mean,
Well, it's very likely.
mhm.
It's very likely, not automatic, very likely to be IVF.
I mean, I know that's one of the questions that we had come up a lot.
Mhm.
People being having the misconception that IVF is only for people advanced age.
But you know why it's so is this. Those advanced age coming for IVF
Mhm.
were young with their
Yeah.
that they could just get pregnant.
Mhm.
You know, that reason never comes until they go and they approach the fertility specialist for care.
Mhm.
You know, younger ones don't also have funds.
That's true.
They don't have the
That's
funds
true.
because some it build funds, and it may take years to gather the money to have an IVF. People just wait and wait and wait for
Until
some form of interventions, natural or spontaneous interventions to
mm,
happen. And for some, it happens, for some, it never happens. And then they come to you at IVF when things are very complicated.
yeah.
No eggs, they need eggs donation. No good sperms, they need sperm assist, sperm
Until no.
donation, you know,
Yeah.
or no egg, no sperms. And they need and throw question to freeze their eggs
Mm-hmm.
because they're not sure what the future holds.
Mm-hmm.
Yeah.
I mean, well, I
I
mean
love
that's
seeing those.
that's a good thing with the
Uh,
women getting more
uh-huh.
enlightened about
Exactly.
everything right now. There's pros and then there's cons. We've spoken
Hmm.
about how long it takes before you feel ready to
Hmm.
want to start a family, and then you're already advanced in age. But then at the same time, you're a young person out there, you should actually be very interested in your fertility, your reproductive system, everything. I mean, it's part of what makes you you.
Hmm.
So it's something that is going to affect your future, whether or not you want to have children in the future. So you know what steps to take. If you don't want to have a
Exactly.
hair, you know what to
Exactly.
do. If you want to have, then you know what to do
Exactly.
in future as
So
well.
yeah, so they should visit and just get some enlightenment.
Yeah.
And good enough these days, you could have every information online.
Hmm.
You go to YouTube, go to TikTok, go to Instagram. You have some very quality information because there
And
are scientists around
yeah,
saying all of those things,
hmm,
and then you can just follow and make research for yourself,
that's
and then
true.
you know which steps to take. But uh, people need to take fertility very
Very
seriously
seriously.
because guys with low sperm count, for instance, chances are that the sperms deteriorate over time.
Hmm.
So if your sperm is low, it's advisable to also preserve what you have if you're not married,
Exactly.
because whatever makes it low
It's
may
going to keep
continue
making it
making
low.
it low,
Yeah.
if no intervention is given.
Mhm.
And so you just get settled at the point where you have no good sperm to make your woman pregnant.
Yeah.
So, and that's a problem. That's a problem. I know in France right now there is a program that when your sperms deteriorate to certain level,
Hmm.
you are advised to freeze.
Okay.
Yes, to freeze. Yeah. So you could have some things to do. And I'm aware also in Europe, some multinationals,
Hmm.
companies advise their female staff, the high flying female staff, to freeze the eggs, and they are paid for.
Wow.
Yeah, I think that's a very good way to
It
treat a
is.
lady,
Yeah.
to treat a lady. So when they need to have babies, they can actually fall back on their frozen
Okay.
eggs and have babies.
Okay. Well, thank you so much, Dr. Ken.
Hmm.
This is very enlightening, very interesting, and it's really nice to get your perspective on, things that we may not be very sure about. It's always lovely having you here. Thank you for joining us again. And in case you're just joining us for some reason, well, we spoke about age and fertility, what medicine can and cannot change about, your age and how it relates to fertility. So basically, medicine cannot change your age, right? For now, anyways, what we have,
Hmm.
you can't change your age, you can't reverse that, but you have some fertility options that are available to you as a young person. Timing is important. If you're trying to preserve your fertility, you can do that. And if you're already of advanced age, there's still options available to you. So if you're just joining us, you could do well to go back from the beginning. We have a lot of interesting things there. And like Dr. Ken said, there's scientists all over the internet, yes, but I'm imploring you to stick around on ours: YouTube, TikTok, Instagram, Facebook. We have information for you on there. All of our live sessions are still uploaded on these places. So you can go on there and you can drop your questions in the comments. We would love to answer any burning questions on your mind. Thank you for joining us today. We'll see you next time. Have a lovely day.